Good afternoon, fellow classmates and teachers. My name is Nicole Taylor and I'm a nursing student at ACU. Today I'll be discussing the provided topic of tonsils within the body and the normal anatomy and physiology. This presentation will answer the question, can you live without tonsils? The provided topic is tonsils. There are three types of tonsils: plate line, lingual, and pharyngeal tonsils. Plate line are found in the back region of the throat, linguinal are found in the bottom of the tongue, and pharyngeal are found in the top of the throat as well as behind the nose. Plate line are the tonsils that lead to some patients having tonsillectomies and tonsillitis procedures. The tonsils are almond shaped and they are on either side of the lateral wall of the ophionax, within the tonsillar fossa. The tonsils are within the body's lymphatic system and are the first line of defense within the body against any bacteria. The plate line tonsils are known to be the largest form of lymphatic tissue within the Walder's ring. They have small areas which they can remove and confine pathogens in the body. Lingual tonsils contain small amounts of lymphatic tissue and protect the body from infections that enter via the mouth. Pharyngenic tonsils are also known as adenoids and are also part of the lymphatic tissue within the Walder's ring. They act in the first line of defense at the mouth and nose, attacking pathogens. Walder's lymphatic ring is formed to block the penetration of pathogens going into the digestive and respiratory tract. All tonsils contain immune cells, white blood cells, lymphatic tissue, and primary lymphocytes. They all work together to provide immune defense for the body, recognizing and attacking any pathogens that try to enter via the oral cavity or throat. The tonsils are a key aspect in younger children aged 3 to 10 years of age, fighting infections, as this is when they have the greatest immune activity, and over time as we get older, their role in fighting infections becomes less prominent. Tonsils are an important part of our immune system that include the B and T lymphocytes that provide both cellular and humoral immunity. Adaptive immunity is the human body recognizing and defending pathogens that it has encountered previously. The cells are activated by molecular patterns and signals are sent out. Phagocytosis then occurs by eliminating foreign particles, causing inflammation and immune resolution and secretion of biologically active molecules, or indirectly via antigen-presenting cell activation-mediated adaptive immune responses. The physiology of tonsils within the body includes the processes of adaptive immunity, pathogen trapping, inflammation, antibody production, antigen recognition, lymphatic tissue, and immune functioning. Yes, you can live without your tonsils. You do not rely on them to survive, and it is a common surgical procedure to have your tonsils removed, known as a tonsillectomy, if they are causing any detriments or global health issues to one's quality of life. Removal of one's tonsils can result in infections, bleeding, and changes to taste and voice initially, and then after the healing process, the patient should return to normal daily activities without any changes if no complications arise. Hemorrhage was a common reason for emergency presentation and hospital readmission for a tonsillectomy procedure. In order for patients to receive the best care and outcomes, integration of patient education into tonsillectomy care is crucial by healthcare professionals. Patients may never have complications with their tonsils, meaning they are fine to continue their life with them as they are showing no detriments and are part of a normal body structure. Common reasons why the tonsils may be removed for patients include recurring tonsillitis, obstructive sleep apnea, tonsil stones, tonsil cancer, chronic tonsil infections, and chronic enlargement. Tonsils are a part of the human body that will be encountered with every patient. An A to G assessment is required during an initial assessment. A refers to findings for the upper airway, meaning the airway is checked for any abnormalities, signs, blockage, blood, redness, or swelling. The tonsils are a part of the upper airway and therefore are checked with every patient upon admission. As a future nurse, a medical admission that would affect specifically the tonsils is tonsillitis, a common disease of the inflammatory of the tonsils, making up 1.3% of outpatient visits. Tonsillitis is a bacterial or viral infection presenting as commonly a sore throat. In conclusion, patients can live with or without tonsils depending on any health concerns and the quality of life. Tonsils help with the prevention of infection and disease against pathogens, and tonsils may be removed if they are a detriment to the health of a patient. Within healthcare settings, tonsils is a common human structure that is analyzed and is essential for nurses to be able to locate, monitor, and identify any issues or abnormalities for patients.